Hi, everyone, and welcome once again to another episode of Shoes Off Inside with me, May Lee, Kelly Hu, Tamlin Tamita. And so, hello, everyone, nerds of color, woman. Love the t-shirt.
You
Love the
always have
t-shirt.
the best shirts.
She really
Yeah, I have
does.
a big collection. And they're mostly, gifts or something, but I get these cool ones. This one was from Lin Chen when I did her movie I Will Make You Mine, and it's from a gift from Keith Chow, and he says, "Can Tamlin wear the shirt for her character?" And I go, "Sure." So
I love
adore
it.
them. Adore
That's so
everybody.
great.
Yeah.
It's so cute. It's so cute.
Yeah.
Well, okay. Well, so this episode, it kind of was born out of one of our most recent episodes on menopause, right? We all remember that one with Dr. Sherry Ross, who's fabulous. And we talked, we felt like we just skimmed the surface, right?
Yes.
There's so much.
There's-
so much
yeah.
about menopause.
So much about menopause, but then there's
And
so
women's
much
health.
about women's health, right?
Yeah.
Everything from sexual health to just like, ailments and issues that nobody knows about or nobody wants to talk about.
Right.
And one of the issues
Right.
that came up was the whole concept of vaginal rejuvenation. Okay. I know people are now going, what the hell? So just stay with us. Stay with us. Vaginal rejuvenation, it's a term that's used kind of loosely in this day and age because the thought that comes to people's minds is, oh, that's the whole like, oh, you want to become younger and like
Nip and
fresher.
tuck and yeah.
Exactly, nip and tuck down there. And so we thought we'd try to explore that whole idea and the reasons behind it, both good and bad. And, so we decided to try to invite an expert on that, on the whole idea of that reconstructive surgery, everything below the belly. But the one thing I wanted to share with you ladies is that I've been saying I'm entering menopause, right?
Mhm.
Right?
At 57.
At 57, which is late.
So
right?
late.
Yeah.
Yeah.
Because the average age, as all the medical experts say, is 51 for menopause. So I was like, okay, finally, I'm starting because I thought I had the symptoms. I like, the brain fog. I can't sleep very well. Lethargy. Yeah,
Welcome.
I know. And then some dryness, right? And when I say dryness, we all know what we're talking about, right? So I went to my gynecologist just a week ago, and she said, okay, let's do some blood tests, but it sounds like you are, entering menopause. But she kind of questioned it because she said, but you don't have night sweats? And I said, no, I don't have night sweats and I'm not having hot flashes. She's like, that's interesting. But she's like, okay, that doesn't mean you're not starting menopause. It could, you might not have those symptoms.
Right. Not everybody does. I
Right.
don't.
Right. So she ordered blood tests, but then she said, because I think you are starting menopause, let's start you on some hormone treatment. So estrogen patches, so they're little patches, and then progesterone. So she said, these are very low dose. So let's just try it and see how it goes for now. But before you start, go get your blood work. Right? Okay. Makes sense. Go get my blood work. Then afterwards, I start the patches and, whatever. Get the blood test back. My doctor calls me when I'm out to dinner at 7:30 at night. And I'm like, oh, this can't be good. Right?
No.
I'm like,
Oh,
what
no.
doctor calls a patient at 7:30 at night? And so I'm like, hi, Dr. Leff. And she's like, hi. Okay. So I took a look at your blood work. I'm like, yeah, I got the test results too. She's like, well, what do you think? And I said, well, I don't know. I don't really know what it all means. And she said, okay, well, it's very interesting. You're not in menopause.
Wait, what?
Exactly. That's what I was like, what? She's like, yeah, your estrogen levels are totally normal.
Ooh.
And I'm like,
Wow.
what do you mean? She's like, that's why you need to come back in and we need to have a longer chat because this is very interesting. Yeah.
Is it dangerous? Is it bad? Is it good? Is it what? Is it anything?
She didn't really say, but I mean, I could hear, let's put it this way. I could hear in her voice that she was even like, this is
Baffled.
a little perplexing. She even at one point said, yeah, this could be a little bit experimental, what we talk about and like how we approach this, because it
Mm-hmm.
is
Mm-hmm.
pretty unusual, right?
Okay. Okay.
So I went
But you
back
haven't seen your doctor since
tomorrow,
that.
tomorrow.
Got
Yeah.
it. Okay.
So there you go. I
Okay.
know.
Okay.
I'm like this freak, of nature, I guess. I don't know.
No, 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 not freak of nature. It's like this is you, and we look forward to the next episode of Shoes Off Inside with MKT because we will find out her
I know.
doctor's diagnosis. It's like, wow, okay, okay,
Yeah.
okay,
So look,
wow.
I'm sharing this because we've talked about it, and I really thought that I'm fully starting menopause. But I also want to share it with our
Which would make
listeners.
sense.
Yeah, with our listeners, viewers, is like, wow, and perfect segue to this interview that we did with the next doctor. Not everyone's this, and no, we aren't the same. Everyone
Right.
is
Mhm.
different.
Yeah.
Everyone has different side effects and symptoms and different, different timing. And I mean, this just goes to show you have no idea. So it's so important to go see the doctor and
Hmm.
do
Hmm.
these tests and really seek expert advice on this stuff,
Right.
right? And
Right.
that's the problem. Oftentimes, especially women, we don't go and to the doctor. We won't ask the doctor about something that's going on because we're either too embarrassed or it's too shameful or we don't think it's a big deal.
And sometimes after menopause, women think that they don't need to see a doctor anymore and they stop
Ah,
going. Yeah.
right. Right, because they think it's just like there's nothing that could go
They're
wrong.
done.
Yeah.
Right.
Yeah.
Nothing to take care of. Yeah.
Hmm.
Nothing to take care of. Yeah. Well, so we invited Dr. Cheryl Iglesia, and she is the director of the section of female pelvic medicine and reconstructive surgery. So she's the real deal, true expert at MedStar Washington Hospital Center and director of the National Center for Advanced Pelvic Surgery. Now, the reason why we want to invite her is because she's a leading expert in this field. So she knows everything about everything that goes on with women's health. And she says below the belly. And so she really, wanted to help us understand, the various issues that go on in a woman's body and also the problem with sort of this trendiness of vaginal rejuvenation and how it's like a celebrity thing and it's something that people aren't aware of, like the need for it, and then seeking out the right people to talk to
Right.
about this.
I can tell you firsthand, I did the whole Mona Lisa thing. Remember when that was a thing, right? And
Well,
Can
explain
you
to
I did
explain
it
people.
what Mona
Yeah,
Lisa is
explain
for
to people who
it's
people?
don't
like
know.
this laser treatment. You have to have this special machine, right?
Uh-huh.
And it's this laser treatment that they do down there inside, and it's supposed to help tighten you up. It's supposed to help rejuvenate you. It's supposed to help. Also, for me, my concern was bladder leakage, right? Because every time I would exercise, like do jumping jacks or laugh too hard or sneeze, God forbid I would sneeze, and I maybe get some leakage down there. So I was like, I gotta fix this now because I'm still young. I might live another 50 years with this.
Yeah.
Right, 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 right.
Yeah.
Okay.
So I did the Mona Lisa. It cost $1,000. And it's one of those things where you have to keep up with it. It's not as though it's like a one-time
Oh.
treatment and then it's cured. Like
Mhm.
every year you have to pay $1,000 or something and go and get it done. And so I tried it thinking that might help my bladder leakage, but it only helped minimally. I don't think it really
Okay.
made a significant difference.
Okay.
Certainly not worth to me. It
Okay.
didn't help me. Certainly not worth the $1,000.
Did,
Okay.
So,
did you
but
go
then
to
again, maybe
who did it for you? Like, did you go to a clinic? Did you go to
Dr. Ross, Dr.
Dr.
Ross.
Ross did it? Okay.
Yeah, she got one of those machines. Yes,
Ah,
Okay.
okay.
yes.
Okay, so at
Okay.
least you
Okay.
went to a
I'm a
proper doctor and expert because the problem is a
Oh
lot of
my
people are
God,
going to
yes.
these clinics, right? Where it's like not even a proper doctor. They're nurse practitioner, not to downplay nurse practitioners, but again, they're not experts in this field of pelvic reconstruction and rejuvenation and all of that. So there's some shit that can go down in not a good way if you don't seek the right kind of expert. Let's go to this interview, and then we'll talk about it on the other side. Dr. Iglesia, welcome to Shoes Off Inside. We're so happy to have you here.
I'm really happy to be here, May and Kelly. It's really a big honor of mine.
Well, we are so excited to talk to you about so many things because, as we just said before, we did an interview about menopause recently. We did an entire show about menopause. And we said to ourselves, each other, we're like, man, there are so many other things to talk about when it comes to women's sexual health. And so we said, we got to do another episode to talk about other issues that are more serious, but also, connected to menopause, et cetera. So we found you. And you are definitely one of the leading experts when it comes to everything below the belly with women. But if we could just start off this way, there's so much sort of misinformation out there, right, when it comes to women's sexual health. And also it's shrouded in embarrassment and shame and fear and all of these things. So what do you come across often in your field when it comes to issues about women's sexual health, and like, how do you get over those hurdles?
Well, it is very common to have a sexual dysfunction, but a lot of it comes in under the guise of, oh, by the way. So most women don't prioritize their sexual health. Actually, I would say they don't even prioritize their own health. There's so many things going on, with their children, with their other family members, aging parents, that I think that a lot of women, and I would say even particularly Asian American women, put themselves last.
Right.
And a lot of the things that can happen below the belt, below the belly button, they think that it's just, their cross to bear. This is like the sacrifices. This is what happens as you age and are a woman, and you just have to suck it up. And I hear that a lot. And, for the people who come to see me, because I'm a pelvic reconstructive surgeon, sometimes things have been going on for many years, if not a decade or more.
Yeah.
And so, as you know, menopause, happens. The average age in America is 51.7. And by 3 years post-menopause, one of the most common things that you see in over 50% of women is the vaginal dryness, all of which is reversible. But it then starts to be like, oh, well, it hurts so much to be sexually active, intimate, blah, blah, blah. Then you start getting the urinary tract infections that then you're getting treated for multiple antibiotics, or there's abnormal discharge. You're getting treated for like over-the-counter anti-yeast medications and bacterial medications, when all of it is actually preventable with just a little bit of vaginal estrogen.
Right, those little tablets, those inserts.
There's little tablets, little inserts that are not just, there's different, there's creams, there's tablets, there's a ring, there are suppositories, and there's estrogen, and there's even pre-testosterone. There's even a pill for people who don't want to take, but they don't want the systemic hormones. They can take a pill that is just for the vagina. It's a designer estrogen that's just for the vagina. That's not going to cause the breast cancer. But all of this stuff, it's unfortunate that people don't talk about it, and they don't connect all the dots. You see, because a lot of this is preventable if we know that this is what's going to happen, to 50% of women by 3 years after the menopause. We can prevent a lot of it so that we don't lose the elasticity. We're not getting the urinary tract infections. We can have sex without pain. And it will prevent those downstream infections, including terrible kidney infections that can happen from your recurrent urinary tract infections.
Man, there's so much going on. But Kelly, I know that before we were talking about this in the previous show on menopause, you started using some of the suppositories.
Yes,
right?
I started using those little estrogen, little pill inserts.
Yeah.
Tablets.
Changed my whole life. I mean, because I like a lot of my friends who are in their 50s, they are still single or newly single. out there on the dating world, we are still sexually active women. I mean, there's a lot of women who are just tired, and I get it. You don't have to be sexually active. But there are those of us who have never had children, or maybe, their children are out of the house, they're newly divorced or whatever, they're back there out on the market, and they want to be sexually active, but if it's absolutely painful and disturbing to be sexually active, then you don't feel good about yourself. You feel like you're done. Your good days, your dating days are over.
Right.
And you need to be able to talk about this. But a lot of times what will happen is they'll come in and you're getting your breast exam and your pap smear. Maybe it's time for your bone density and et cetera. These are well woman checks. And then you're at the door and the doctor's walking out and he's got his or her hand on the doorknob. And you're like, oh, by the way, doctor, I just wanted to let you know, like, the sex is really painful. But then, they're out the door.
They're out the door. Oh, my gosh.
You really needed to be able to talk about this. But,
right.
What I find is that the patients don't bring it up like 75% of the time. And the doctors aren't asking like 75% of the time because they have their 15 minutes of managed care. So then it just gets, and and the patients think, oh, well, she would have said something if something looked bad, right? She would have said something.
Yeah, I think that's why we want to have these conversations, right?
Yeah,
because we have to start talking openly and being very honest about what's really going on. And again, remove that shame and that embarrassment. I mean, it's our bodies, right? I remember talking to some friends about, have you ever taken a mirror and looked at yourself, right? And most of they're like, what? No way. And I said, yeah, well, I hadn't either until just like literally a couple of years ago, And so, yeah, I know. No, it's weird, right? It's one of those things like it's our own bodies. And yet we think, oh no, I can't look down there. So
isn't that crazy? We put the taboo on ourselves.
Yes.
Like ourselves. Okay,
well, I'm Filipino and we even have a word for like you're supposed to use this thing called the taboo. It's like a basin, a pitcher. It's against every toilet because you have to wash yourself. I was taught after I got my period, you have to taboo and then the word for vagina, which is keng. Taboo your keng. I'm gonna go ahead and do this. But the craziness thing is that it gives you the thing that it's dirty.
Yes.
So there's that culturally speaking, which I don't know that it's in other Asian cultures, but that is there's definitely something like that we do there. And that brings up, I just wanted to talk about the estrogen for one thing, and I'm going to talk about looking. So for you, I'm so glad that you found someone who could do something that's so simple. Insurance covers it. It's FDA approved. The reason why women don't want to use the estrogens is because they're afraid it's going to cause cancer. And it's because it was based on the hormone study, the very big hormone study. And I do want to say that we were a site, and I'm a co-investigator in the Women's Health Initiative, which was that huge multi-million-dollar study that looked at Premarin, and progesterone versus placebo. And they were looking at it for the prevention of heart disease. And it turned out that there was a higher breast cancer, the blood clot.
Right. But it was a flawed report, right? It was a flawed report in 2002.
Yes, it was stopped early in 2002. And everyone always cites that as a reason why you shouldn't use estrogen, because it's going to give you a heart attack and a blood clot and breast cancer. But the bottom line is, that is very different when you take it by mouth versus what you put the microgram doses that you're using in the vagina. And we just need just a small amount to have a local effect, but that local effect can affect the whole microbiome, prevent UTIs, make the tissue more elastic instead of being so thinned out and bloody and hurting. It helps. So now that was the one thing. And we do need to get that message out that there are FDA approved formulations, because there are a lot of people going on to different things. And this is where I have a little bit of an issue with all this vaginal rejuvenation. So people are taking the mirrors and they're going down there And many women, I would say the millennial types, like 80% do some kind of pubic hair grooming. But even people, the baby boomers, like 30%, they're waxing, they're shaving. So they're looking at their lips, they're looking at everything. There's like, and they've had babies or whatnot. So if it could look dry, it could look really stretched out and wrinkly or whatever.
I call them my mud flaps.
Oh my God, you're going there, Kelly. You're okay.
You mean for the labia, you call it your mud flap. And that's a negative connotation, Kelly. That's not a mud flap. You should think of it as a petal, as a flower, not a mud flap.
Dr. Iglesia?
Wait. Petals that are about to fall off.
Okay,
No,
Dr. Iglesia.
In full bloom.
Kelly said this before to Tamlin and I seriously thought I was going to fall out of my chair I just seriously was crying when she used that term. So she's going there. So let's go there because
let's go there. Okay.
Yeah.
And that's why
someone like myself still sexually active out there in the dating world, I'm embarrassed about it.
See, this is the thing. This is definitely, there is, and I actually want to say this relates to the porn industry and to the whole pubic grooming area. And I actually, I wrote a paper about this, we wrote about techniques for labiaplasty, because you're talking about the labia minora when you're talking about, which are the minor lips, and then you've got the labia majora, and people are worried about their whole camel toe and all of this. But problem is that there's no one uniform type. Some people think that Barbie doll look where you have no labia minora protruding out, it's supposed to look like a Barbie doll where the inner lips are smaller than the outer lips. That is not natural. That is called like prepubescent, like pre-puberty. That's like you weren't even a full woman in full bloom. So that is a look that has become like standardized in a lot of porn magazines, centerfold types. And I think it's gotten worse as people are doing all the pubic hair grooming, because now you got a clear shot.
Right.
But the problem is that people have such a narrow view of what is normal, and we see shows like Sex in the City when the woman has the pubic, Cynthia, whatever her name was, sticking the pubic hair is kind of coming out of the bathing suit, and they're like, oh, you need to get that taken care of.
Yeah.
Or even the body shaming, when the fact of the matter is it is normal for the inner lips to be larger than protruding out. Sometimes there's asymmetry, and sometimes you might, having tampons in and the lips are coming through, and I can get that. It can be in the way, but the majority of people, your lips are normal. And I worry that people are getting a lot of stuff done unnecessarily and paying like thousands of dollars. But I also worry about that they're getting these messages really young.
Yes.
And so, like 12, 13, 14, and when you start to do that and have surgery on the clitoris and on the labia, it can have major downstream issues as you get older, and even particular as you reach menopause. If you didn't have those lips to protect, it could be even worse in terms of the drying and the scarring that can occur. So this whole concept of what is normal and what a normal vulva looks like, and that it all needs to be rejuvenated to look like a Barbie doll. We've got to shut this down.
Yeah. Okay. That's fascinating. Dr. Iglesia, then when you do any kind of vaginal surgeries, what does that entail then? What is a necessary kind of vaginal surgery then?
Okay. So that's a great question, because I think that's another way. So that was talking about the vulva now. That's another way that women are being duped. They want to go vaginal rejuvenation and make the vagina tighter.
Right.
Because they've had children and things are stretched out. Maybe they're having sex and things are making noises, like air is getting trapped, or they're doing yoga and like, what is that noise? There's a terrible word for it when you have air coming out the vagina. But all of that has to do with the condition known as pelvic organ prolapse. On a minor scale, it's kind of like lax vaginal tissue. But if you think of the vagina, as a tube, and there's that skin lining, the epithelium, underneath that is a connective tissue. It's kind of like the grizzle on a chicken leg, right? On the chicken, the tendon, and that connective tissue, and then below that is like the organs and the muscles surrounding it. So you've got muscles, you've got nerves, you've got connective tissue, and then you've got the skin, known as the epithelium, which is very sensitive to estrogen. So when you have a baby and you're delivering the baby, sometimes when the babies are coming out, you can get tears. And tears not just on the skin side, the epithelium, but tears that go beneath. And they can tear the connective tissue. And you haven't had children, Kelly, but it stretches out. And sometimes you can even tear the muscles. You can even tear through and through, like to the rectum. And when you do stuff like that, when the babies are born and they're coming out, and we love these babies, but they're a terror to the pelvic floor. By the time you're 40, 1 out of 4, clearly 25% of women are having some issues with prolapse or vaginal laxity that can lead to organ sagging. So like when the bladder starts dropping because the connective tissue is torn, a dropped bladder is known as a cystocele. Cysto means bladder, seal is hernia. Basically, the bladder is herniating into the vagina. Same thing can happen onto the rectal side. That's called rectocele. And then the uterus can fall out. In addition to that, you can affect the connective tissue of the urethra and bladder and then start having leakage, like when you cough and laugh and sneeze. You can even have leakage that occurs when you're having sex. And some people are like, they think that's great. That's the golden shower, but it's really the urine, coming out. And then you have issues on the rectal side with, passing gas when you don't want to, or not being able to hold your stool and having fecal smearing. So you can't imagine what women are thinking. This is happening at 1 out of 4 women by the time they're 40.
Wow.
1 out of 4?
That's
1
a lot.
out of 4.
That's a lot.
And they feel bad about it. So now you've been married, you were a mother, you had the babies, half of marriages that have been divorced, and now you're going back. You're now you're on Hinge and Bumble, and you want to get back into action. You feel bad about it. Right. You don't want to talk about it because people don't talk about it. So then they go to these sites to get rejuvenated. I want to get rejuvenated. But the fact of the matter is, it's a complex situation that you don't just need a laser to tighten up the skin. You really need to see what is broken, what you can rehab by doing physical therapy.
Wait, Dr. Iglesia, that you just mentioned something that I want to pinpoint, because I've heard of people going to get the laser treatment, right, to tighten things up.
The Mona Lisa.
Yes, so that's really interesting that you're saying that they're not pinpointing maybe the deeper issues.
Exactly. We need a full evaluation by someone who's trained and not just here to, basically do a wallet biopsy, get paid. Right. And I see it, and I see women who have like major pull-ups that literally their bladders are hanging halfway between the vulva and the knees. Oh no. And someone offered laser to this woman, which isn't going to ever help, and cost her $2,000, of which she was, she worked at the bank. No, a lot of people don't have that extra $2,000. You see me, you see somebody who's trained as a pelvic reconstructive surgeon, urogynecologist. This is what we do day in and day out. Yeah. We identify where the defects are. We tell you your options. We talk about, maybe we can just do a little physical therapy. Maybe we can add some estrogen. Maybe we can, do a procedure using your own tissue. In some cases, we do need to do mesh, like a mesh related repair, but the safe meshes, the ones that are used and are FDA approved and have long-term safety and efficacy. The bottom line is you need someone to understand what bothers you, what your goals are, and how can we treat that to meet your goals without taking your, a total advantage of your own insecurities. And I honestly say that because I've seen thousands of women, and people are ashamed about this. Just like you were saying, they're ashamed about getting into the dating scene, having sex, and someone's like, oh God, I can hardly feel anything. Or they have erectile dysfunction and they're blaming it on you because they're saying, I can't feel it. It's so loose in there. I mean, that's ridiculous too. But this is what happens, and everyone blames themselves.
Oh my God.
So you hit on one thing that I think a lot of women suffer from, and that's like a leaky bladder, right?
Yeah.
And that comes with age, correct? Whether
Yeah.
you've had children or not, because I
What?
know I had to stop doing jumping jacks in my class, because I'm like worried about leakage, or I have to go to the bathroom right before we do jumping jacks.
Okay.
Or, I sneeze and I cross my legs and I
Yeah.
hope to God that I'm not gonna like leak through, right? So I only recently found out from another girlfriend that there's PT, like actual exercises you can do.
Exactly. They're called pelvic muscle exercises. And you know what, Kelly? Sometimes we do have with aging, estrogen can help that. But there are little devices that you can put in, like tampon-like devices, little diaphragm devices, just when you're exercising. You don't need major surgery, and we can work on this. But the fact of the matter is we need to define what causes it, because there's different types of incontinence. What you describe with the jumping, laughing, coughing is the stress urinary incontinence.
Right.
And we can work on that with muscles. We can work on it by using some estrogen in the lining. There's different devices. We even have injectables. The urethra is a little loose. So we have little, like, a filler, and in some cases you need surgery. But I have to tell you, surgery in the right hands and in the right patients can be curative, like 86% of the time. So we need to have that, because people are paying for all these lasers, for which we have no evidence for.
Right.
Again, we need to see specialists who actually can make the right diagnosis, because when you talk about urinary incontinence, by the time you're 80, 50% of women have some form of it, and then there's overactive bladder, which is very different. That is the gotta go. And maybe that's what you're having too. And that's why you empty your bladder before you go to your class, because you're going to be able to sit through that whole, or exercise through that whole hour class, because you're drinking and your body's going to fill up.
I was even afraid of laughing too hard.
Yeah.
Because
So we need an evaluation, Kelly, because it's all treatable, and to some degree it's preventable. But I have to say, get the right diagnosis made. We have so many new therapies. We not only the pelvic muscle exercises, some of the devices, some of the fillers, but we even have home, I call them Fitbits for the vagina, for you to do some of this stuff on your own. And we have Botox for the bladder. We have medications. Some of the medications you have to be careful about, because some of them can cross the blood-brain barrier, and if used, particularly in older patients, for too long, can lead to dementia. We know that, like for dementia and cognitive impairment, probably 10% are due to drugs. So I'm very careful about using the drugs. But I have to tell you, we have acupuncture. We even have pacemakers for the bladder. So you need to know what the diagnosis is, so that you can get the right treatment. Because why should you be wearing these diapers? And why should you be living yourself to be able to go to your class? I mean, these women are like, I'm not going to go to the Chinese dance. I'm not going to go to church because I'm afraid I'm going to be on the pew. I mean, that's not right. You want to live your best life. And that's what we want to make sure that people know about,
But
right?
My mom is 84 years old. And she recently told me that she doesn't want to travel anymore because she's afraid of not being close enough to a toilet.
To a bathroom. Yeah. That's a quality of life thing. But here's the thing, Dr. Iglesia, you just mentioned a dozen different types of, remedies and, therapies that people really don't even know about. Really, I mean, here's the thing. People don't know about these options at all. Why is that? What's the problem? Why isn't this information being disseminated and being made more public? Is it the media? Is it the medical world? I mean, why isn't this getting out?
Because it's not sexy. And what spokesperson wants to go out there as an actress and say, when I sneeze, I wet my pants?
I'll do it. I'll do it.
You do it. You have a beautiful face. You're healthy. You're thin. You know what? Yes. Let's let you do that. We need to get people who are brave enough to say, but then also say that this is, treatable.
Yeah. That's the thing. It's treatable.
I think a lot of people they're just kind of ashamed. It's very interesting, because when you look at the guys, like if the guys had it to the same degree, I mean, look at erectile dysfunction. I mean, there's how many drugs? We have 23 drugs.
Yeah.
And maybe
Viagra commercial. So I know firsthand. Yeah.
It's exactly.
Huge. It's huge. But how many drugs do we have for female sexual dysfunction that are FDA approved? Maybe 3.
Yeah.
You know?
Yeah.
And so I think there's that. I mean, that
There's
it's
something,
almost
yeah.
Victorian.
No,
you
I
know,
think there
like,
has to
you
be
know,
a
we don't talk about this. This is what you're supposed to. This is what happens as you age, and then we get written off. You know, it's you get written off. You know, and
well, that's the
and just live
ageism.
with it.
That's the ageism part that we want to try to combat, right, and push back on, because
And that's why I'm so glad that we have this, that we're having this conversation, because, you know, this should not be these kind of pelvic floor disorders, urinary incontinence, pelvic organ prolapse, fecal incontinence, and even sexual dysfunction. This should not be holding us back. We
Right.
really should be living our best lives.
Right.
Past menopause. We don't have to worry about getting pregnant anymore.
Yeah, exactly. There's a freedom.
It should be our golden years, not our golden showers. I mean,
Right.
seriously.
Right. No, amen, sister. But I have a practical question, Dr. Iglesia. I have a practical.
Don't laugh too hard, Kelly. You make me laugh.
No, I got the estrogen. I'm good.
I have a, if I may
Giggle,
ask
giggle.
a practical question, I think a lot of people probably are also wondering, is that all of these therapies and surgeries and options, are they covered by insurance?
Yes.
They are.
Yes. That's why I'm saying
Ah,
that women are being duped. You're going to these you're going to these wellness spas, these rejuvenation lasers, well-being centers, and you're paying cash for stuff that has very little evidence, if any at all. It's for
wow.
marketing, the head of the science on that. And we have other people that are board certified. I mean, I'm double board certified. And we have the treatments, but, you know, it's not as sexy. And we are sort of overworked a bit, you know, so you can't be well and sick at the same time. So doctors aren't talking about it. But quite frankly, people who are urogynecologists, you know, who are, you know, specialists, and you can either be an OB/GYN or a urologist. Those are the two specialties that are boarded in this. So you can be boarded in OB/GYN, boarded in urology, but then you get a separate board certification in urogynecology, also known as female pelvic medicine and reconstructive surgery. You can go to the American Urogynecologic Society, AUGS.org, and find someone near you. You can ask for you, and I'll
say
help
that
you.
again. Say that site name again.
Oh, it's the American Urogynecologic Society, AUGS.org, and find someone who specializes in this. And you know, it's hard because, like, most of us who are legit don't have all these fancy websites that sell all the cosmetic type of gynecology.
Yeah.
And so, but they're much better at marketing than, say, me, and who can, they're charging so much money too for all these other kinds of like alternative procedures. But I do think it's good to have a second opinion, even if you decide to go for something. And there are some things that maybe it would be working for. There's some skin conditions, maybe as an adjunct to some other treatments. But let me just tell you, I think we should go with the tried and true. And the NIH has put millions of dollars, but people don't know about the Pelvic Floor Disorders Network, which is a huge network that has done the clinical trials that have randomized women to the gold standard treatments and have followed 5-10 years so that we know what works and we know what doesn't, and we know whether the right patients for the right different procedures. We have so much knowledge about this, but, you know, it's not getting disseminated out there. It's an unfortunate thing. That's why I said yes right away, because we need more women to be able to have the conversations that are legit,
Right.
so that they're not feeling just ashamed. I think that's the thing that's holding people back.
Yes.
I think more women are wanting to talk about it these days.
I think so
Yeah.
too.
There's less of a stigma than there used to be. I mean, you know, it's not just us talking about it. It's a lot of women nowadays
You are seeing
who are
it.
willing to talk about, you know, women's issues and women's health. And if not us, who else? You know, who else is going to do it? Our parents were too embarrassed. And, you know, I think like you said, there's a lot of misinformation.
Yes.
And so we really need to get the conversation going and get experts like yourself out there giving us the right information.
Yeah.
Yeah. And there's a lot of really good, I mean, it would be really interesting for me. And I know that there are different Facebook websites and other, I don't know, online social media groups, but sometimes there's some information that's wrong there too. So women get scared, from getting certain treatments because they've had a bad outcome, or I don't know, some doctor was selling mesh right away or something like, I don't know.
Yeah.
I think we have to keep it balanced and open. And whenever you're actually having surgery, second opinions are good, but it's really important to go to surgeons that do high volume. I do think that's important. And a lot of women are kind of embarrassed to even say, like, okay, so Dr. Iglesia, like, how many of these do you do a year? Or like, is this your first, they don't want to ask. And I think that that's important. We need a little bit more transparency. I wish that was more available, so that, high volume surgeons, high volume hospitals, you're going to get better outcomes. That is,
well, Dr. Iglesia,
pretty much borne out on any specialty.
Isn't this always the issue, though, with females? Female patients tend to be a little bit less vocal and demanding, and kind of just say, "Okay, doctor, whatever you say." So that's another.
We wait to be told what to do instead of being active.
That's
right?
another
Proactive.
issue that I want to try to press, is that women and young women need to be much more empowered when they go see their doctors, right?
I know. And so I even had a patient even today. She had said, Dr. Iglesia, I'm going to say this because if anything happened and I didn't ever ask, then I would regret, like, what would happen if I don't do anything? And can I do more physical therapy? And this, this woman had prolapse, had really significant leakage at just small amounts. And I said, the evidence is pretty poor because the connective tissue, once torn as a hernia, you can do all the Kegels you want. That's going to work on the muscles. Maybe a little bit of weight loss would help, but I don't know if that's going to, be the end all, the be all. I think that in that particular case, I think that you would do well with putting everything back in place and then maintaining it with the physical therapy. We do, and that's based on longitudinal data. We know that weight loss, like for incontinence, if you lose, for stress incontinence, you were talking about leakage, if you lose about like 5%, or 10% of your body mass index, you are overweight or obese, you can significantly decrease the risk, the leakage. But if you do the same thing with prolapse and you lose weight, the damage has already been done. So it's the same thing with the Kegels because it's that connective tissue. So it's sort of like you have to look at it, the pelvic floor as a whole, looking at the organs and looking at all the systems, the bladder, and urethra, the vagina, the rectum, and the muscles, and then, what the connective tissue looks like and what the state of the epithelium, the estrogen levels look like. So that, takes some expertise. And it's only when you have that expertise, you can give, an assessment of all the different treatment options and the alternatives, and even the option of doing nothing. I very much respected that. And some women, they just wanted to be educated as to what's going on, and they want to do as much conservative as possible. And others are like, no, I don't want that pessary. And when can you sign me up for surgery? It depends on your level of bother, and it depends on the woman's goals, Right. So that's the way I feel like people should be talked about with this. It is elective. This is not going to kill you. These kinds of conditions will not kill you unless you got uroseptic and you got a bad bladder infection and got a kidney infection that's fed to the blood. In general, or the prolapse is so low that it's blocking the kidneys and you're in renal failure. It's very rare for it to be life threatening, but the impact on your life and quality of life is
quality
great.
of life.
Kelly.
Quality of life for sure. Kelly, do you have any last minute questions for the doctor before we say goodbye to her? Because we could talk to her for hours on end about this stuff.
Like we've just scratched the surface once again.
I know.
Yes.
So much.
And I'd want to give you more people that we can talk to about different things. I
Would
think you should be talking
love that.
about abnormal bleeding. I think we can do a segment just on incontinence. continence. I think we can talk about the sagging organs.
So
We can talk
much.
about other sexual dysfunctions, including desire, arousal, orgasm, and pain.
We would like, yeah, I think we should definitely get into that subject too, because, you know, I talked about this before in the last episode, but I am just starting menopause at 57.
Okay.
So I'm very
Yeah.
late. And I
That's
just went to
okay.
see my OBGYN yesterday to have this
Yeah.
discussion. So,
Okay.
yeah, so we're going to try a couple of
So we can
different.
talk about a segment just on the vasomotor symptoms, which is the hot flashes, because there are actually new technologies that are coming out that are focusing not hormonal, but centrally on the neurons that cause all these hot flashes
Oh,
in your
wow.
hypothalamus. They're called the candy neurons. But people need to be made aware of this.
Yeah,
So
see, there's
I
so much
need
unknown.
a segment on the brain fog.
Yes,
on
that
the brain
too.
fog. Yeah, we can do a segment on brain fog. Yeah, for
See, there's
sure.
so much to
And some of
talk
the drugs.
about. So much to talk about.
And
So,
I think weight management and stuff. I'm just so glad you guys are having this. I really
oh,
applaud you. I admire you. I thank you for even exposing yourself and giving some personal. I think
we have
there's going to
to.
be a lot of women who are going to relate to that.
Yes,
So
we have to.
kudos to both of you.
I think if we're all honest and open about, you know, our situations, then I think more people will feel comfortable to talk about it, right? And not be ashamed. So because, and I'm not going to get political here, I'm just going to say one thing, because right now it seems like women and girls are under siege for a lot of reasons. And I think all the more reason we need to empower ourselves with more information, and so that we can take care of our bodies in the way we should and have the right to do so. That's all I'm going to say. So, but Dr. Iglesia, thank you so much. This was incredibly informative, but we're just scratching the surface. We will definitely have you and your colleagues back on the show, because I think this is something that's worth talking about endlessly.
Absolutely. Thank you.
Thank you so much. So, Kelly, I know you and I totally enjoyed speaking to Dr. Iglesia because she just knows her shit, man.
So interesting. Who knew that all like this whole these all these things could happen to your uterus, your like all these things could be sticking out or tearing
or
like
rupturing or
like
yeah.
And women don't do anything about it, or also because they don't even know it's happening.
Yeah, because you can't see it. I mean, the idea, and I'm so sorry that I missed this interview. I'm so fascinated in the topic, but you can't see it. And what women really do investigate, their vaginal area is like how, whatever leakage, discharge, after effects or consequences of what's happening internally, you won't know. So again, this is an important topic that women, starting at a very young age, not even when they become sexually active, it's like when they start becoming young women, they need to be able to get that, our women's
regular treatments.
Exactly. And, it's so much of this is preventative, right? You can prevent some of these later ailments and issues if you know about how to prevent it. But the problem is none of us are educated in that way or informed, because these discussions never happen. So we just kind of live with the pain or the discomfort thinking, oh, that's just part of, getting older,
being a woman,
or being a woman. Exactly. Because our threshold for pain, as we know, is so much higher than a man's, whether or not you've had children. Right. So these are all issues that we need to be aware of. But yet, like Dr. Iglesia said in the interview, so many women are just too afraid to ask their doctor. But she's remember the point when she made, it's like when the doctor is about to leave the room after the appointment is over, that's when the woman will be like, oh, by the way, doctor, I have this issue. And then it's too late because the doctor's appointment is over. They want to get to the next patient. So women and girls have to become more empowered with information so that when they go to the doctor, they can ask the right questions, right?
Yeah. I always forget, right? When I'm in the office and they ask if there's anything going on, I don't write things down.
Yeah.
I mean, I think at this age, I better get into this habit of starting, like, if something hurts or something feels weird, I
Write it
should
down.
probably write it down. So the next time I go and see the doctor, I can talk about it.
Yeah,
Because
that's a
half
good
the time I
idea.
don't even remember,
Right.
or I get like, I guess stage fright, office fright, where you're just like, oh, no, I think I'm okay.
Yeah.
Yeah.
Right.
I think for me, when May, you said ask the right questions, for women and young girls to be empowered to ask the right questions, just ask the questions.
Yeah, that's
It's
right.
like, because again, being very, in the doctor's office, like, I don't know how to talk about this, but I am feeling this and these times, or, I felt it at this, event, in terms of, sexual relations or whatever. You have to describe it to the best of your knowledge, because you live in your body, and the doctor can help you assess what's going on. So you don't have to ask the right questions, just ask the questions. That
Yeah.
there's something off, that there's something
Exactly.
going on, there's something different. So that's what we encourage, women and young girls to start asking.
That's such a good point, Tamlin. It's like, it doesn't have to be the right question.
Right.
It just
Yeah.
just ask. I
Just
think
ask. I mean, my mother, she doesn't, again, I go back to the when she came to the States, she did not know how to use the tampon, and she wasn't going to the doctor. So my father had to teach her, because again, when did she invest, when you stick a mirror down there and say, oh, that's what I'm made of. Yay. It's just like, no, shame, 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 shame. That's where, all the bad poo
Yeah.
and pee come out, and babies come out, if you're lucky. And it's kind of a roll of a dice kind of thing. It's like to be able to take full and prideful ownership of one's body. It was important. And I think that's why this abortion discussion is so important, because this is the issue. This is an issue. And from that, we can trickle down to actually taking care of our organ, our vital organs, our uterus, our everything, the whole package, because again, this is where life comes from.
Exactly. Well, speaking of empowering ourselves with much more knowledge to be able to take care of ourselves, I'm going to take this moment to introduce our first show sponsor, and that is Lemieux. That is a skincare line. I know, yay! And I'm going to talk about a couple
They're
of the products.
amazing.
They are amazing,
Amazing.
and I use all of their
We're
products.
so lucky we got them.
We're
I
so, you know what?
know.
And I'll tell you why. Janelle Liu is the founder of Lemieux. She's Korean-American entrepreneur, and she really believes in the science of good skincare. She you know what her favorite part is? Working in the lab. She loves
wow.
formulating and coming up with good formulations for skincare, depending on, what kind of skin type you are, what age, and all that. She's very detail oriented, very specific about it. So I thought this episode was perfect because it is about taking care of our bodies,
Right.
rejuvenating our bodies in the way that makes sense and is healthy. And
Mhm.
so this segment, this sponsored segment by Lemieux, we want to talk about skincare because that obviously makes sense, right? And especially as we age. So we all have our own routines. We all have our different habits in terms of how we can better care of our skin. So Kelly, why don't you start? What is something that you do?
I never sleep with makeup on. I don't care how drunk I am.
Yeah.
I can be passed
Totally.
out drunk, and I will wake up to
Yes.
take my face off and cleanse my face. Because if I don't, I know that I'm going to end up with zits,
Yep.
or
Yep.
it's just gross. It's
Yeah.
it's bacteria, and I'm really all about like cleansing properly before going to bed.
Yep.
And at this stage in my life, moisturizing. Serums. I do serums before putting on the moisturizer.
Yes.
So
Totally.
Lemieux's got some amazing serums, and then there's the layers of stuff, right? There's the serum, the wash, then the toner, right? I always take the toner, and I'm one of those. I like using the cotton pad to sort
me
of
too.
scrub makeup off and make sure it's all gone, all the dead skin cells, right? And then you do the serum, and then you wait a few seconds because that has to go in, and then, right? And then you do whatever moisturizer or oil that you choose, right? And then of course the eye cream, the lip cream. Yeah, it's a whole process. It takes,
It is, but it's worth
it's
it.
like 15 minutes
Yeah.
in total to get all that stuff clean. And then of course, you got to brush your teeth and floss.
But it's worth it
Yeah,
because
yeah.
look at you. Look at you. All right.
Yeah.
So Tamlin, what are some of your favorite ways that you take care of your skin?
I agree with Kelly. You never sleep with makeup on. And then I do again another routine in the morning. So it's morning and night. And you spritz during the day with your, Evian water, some kind of thing. And if you're lucky enough to reapply your makeup, I never do that. But again, just to spritz your face. But for me, it's cleansing your face twice at night. I do the cleansing balm, then the micellar water with a cotton pad. Then I have to use the toner. Then I have to use a certain brand's essence because I find it really does work. After that, it's hyaluronic acid before the oil, before 3 serums, the moisturizer.
Wow, you do 3 serums.
And then,
Wow.
and then the eye cream. Yeah. And then in the morning, it's just a little bit more. I think it's the just rinse your face. Again, the essence water, the hyaluronic acid, a different oil, and 2 serums, moisturizer, and sunscreen.
Oh yeah, sunscreen.
Yes, because I have melasma.
Yeah.
And so I have to be really careful with the products that I use and the protection of the sunscreen.
And you have to reapply it during the day, especially if you know you're going outside and driving in the car in LA.
Yeah.
I have one thing, I have a confession. So I was in Hawaii doing Defining Courage, and one of the serums at night, one of the 3 serums at night is a retinol, or it's a retinol based kind of serum.
Yeah.
And being lazy because you want to take off the makeup off your face, right? I put it on all over my face and rubbed it into my lips. So I think you ladies are being very kind because my lips are swollen. And it looks kind of
Tamlin, thank God you're saying this.
Like Emily Ratajkowski's swollen.
Yes.
But
is that from that?
I thought it looked so good though.
Yeah, but I know it looks great, right? But then my love, when I came home last night, and he goes, "What's happening with your lips? They're blown." I'm gonna go, "I think it's the retinol because I just did this instead of this."
No.
Like this. I just did this.
Okay, Tam. Thank God you're telling us this, because when you first came on to do this recording, I was like, did Tamlin get like the
lip filler?
Lip filler. And I'm like, there's no way.
Like, I would tell you, but I was like, I'm going to wait till we talk about Lemieux, because again, retinol is great, but don't put it anywhere near don't put it anywhere near your eyes because it's probably with urge. I'm careful about the eyes, but the lips was like, they're just as lips, but I didn't know
that. They're sensitive.
I didn't know that. I mean, you must have. This must have been very strong retinol. I don't know. I have no idea. But oh wow. Wait. Okay. So now that explains, because I thought Tamlin. I'm like, Tamlin's not that kind of girl, but I guess she got some filler.
I am.
I know, but I literally was like, oh my God, Tamlin totally got filler. Wow. Okay, but I wasn't going to say anything.
No, see, because you're kind. But then it's like I was just waiting, and I would have told you off camera anyway, and then we would have talked about it next episode. But it's like it was just like amazing, but it's kind of like it feels like a hack. But again, I want to be responsible and say,
does it hurt?
It's sensitive, but it doesn't hurt.
Oh,
but it's like definitely it's like when you're allergic to, because I can't eat mango anymore. It's like when you swell,
right?
It's
right,
like I ate mango. It's like,
oh my gosh,
but it's that kind of feeling.
Okay, this segment has completely gone off the rails. But anyway, okay, that explains. So everybody, this is a good lesson. This is good skin care lesson. Be careful when you use powerful ingredients like retinol. Yes. Okay. Okay, that's a good tip. All right, that would be a don't. That would be a don't. Don't do that. Okay, so my turn is, obviously I'm going to talk about some Lemieux products because, and listen, viewers, if you're watching or listening right now, I'm not doing this because they're our sponsor. I actually started using Lemieux before they became the sponsor of the show. So I'm actually a real user. I know that sounds so fake, but it's true. It's true. So I use all of their products. So I use
Mm.
several different serums, different moisturizers, toner. I use their IOI, the spray, thing that comes out and ionizes everything. Anyway, but I'm going to just talk about two right now. This is Derma Relief Serum. It is so good. It is like a little oil based, but very slight. So you only need a couple of drops. And I use this after I cleanse and I just,
Mhm.
rub it around my face and it feels so silky and luxurious on my skin. And
I
I
love
can
that.
feel my skin like really absorbing it and like it feels enriched. Like I
Mhm.
can't think of a better way to describe. And then this is the BioCell Rejuvenation Cream. So
Oh,
I
that
thought,
stuff's great.
yeah, this is really like again, a rich cream, but it doesn't go on like sticky or heavy.
Mhm. Mhm.
So it's a rejuvenating cream, which is really, really nice. So Lemieux's products, honestly, like I said, Janelle is a friend now. She's become a good friend and she's so dedicated to the work that she does. She really cares about skincare. And she's also somebody who doesn't want women to feel, that they have to go under the knife or they have to go get a procedure to maintain their beauty. So she's all about that. She's all about trying to enhance what you have and take care of it. So,
Mhm.
Mhm.
so
Where
thank you,
can folks
Janelle.
get Lemieux? Where can
Uh,
folks get Lemieux?
They can mostly
Or meet
online.
Janelle?
Yeah, online at
Okay.
Lemieux.com and that you can order anything and their service is so good. And you can take a skin test. Like they will give you a questionnaire
Evaluation.
online. You answer all these questions and then they'll be able to recommend what products are good for your skin type and your age group and all
Mhm.
that. So,
Okay,
yeah,
so
and
Lemieux is Lemieux.
Exactly.
Yeah.
Yeah. So,
Okay.
Thanks
so
for spelling
yes,
that out. I would
I know.
thank
never have thought of
It's
that.
like
yeah,
Lemieux, like it's that.
Lemieux.
Yeah.
I know it's not Lemaire because some people think it's the other cosmetic line called Lemaire. It's not Lemaire, it's Lemieux.
Right.
But yeah, so they're our sponsor, our very first, and we're so grateful to Janelle and the team at Lemieux. And so yeah, we're gonna keep on doing interesting little segments in every episode,
Yes.
different themes. So thank you. And that brings us to the
Thank
end
you.
of this great episode, which hopefully was so informative to everyone. It certainly was for us.
Absolutely.
But we're going to continue this conversation for sure when it comes to women's health.
As we always do.
Yeah. Yeah. All right. Thanks, ladies. We'll see you next time.